main cause or risk factor of dry eyes, or are there other causes and risk factors?
So if you think of it based on what causes dry eye or dry eyes, this is an umbrella term that is used for different conditions that overall have the same symptoms and signs. So the tears that we have in our eyes, they are made primarily from two types of glands.
Right.
First and the most important gland is called the lacrimal gland, and the second are the meibomian glands. The lacrimal gland is present above the eyeball in the skull, and the meibomian glands are present in the eyelid. Now, these are two different glands. The meibomian glands produce oil, and the lacrimal glands produce something watery, which is the major component of the tear film. These two mix together and form the tears. And just like when you mix oil and water, the oil floats on the surface. The secretion from the meibomian gland, which is oily, floats on the surface of the watery secretion from lacrimal gland. And that is what forms our tear film. The oil is important for lubrication. It is also important for the specific gravity, which holds the tear film in its place. Otherwise, when you're standing up and looking ahead, the tear film would collapse if it didn't have that specific gravity. So you can have dry eyes either because the oil is deficient or not of good quality, or if the water is deficient. And as you can understand, these are two different glands which are being affected, and so they usually don't overlap. So people either have meibomian gland dysfunction and what we call evaporative dry eye, or people have lacrimal gland dysfunction and what we call aqueous deficiency dry eye. You can have both conditions coexisting, but they are unrelated to each other. The way that these glands are affected are different. So broadly speaking, you have two different types of dry eyes, and therefore the risk factors for them are different. So when screen exposure is a risk factor for evaporative dry eye, which affects the meibomian glands. And this happens not because of the light, which like I said, is harmless. It happens because whenever as human beings, we look at any surface which throws light back at us. For example, if you're reading a book, that's absolutely fine. But if you're using a Kindle, or even if you're using a tablet to read something, you blink less because that surface is lighted. So it's, we tend to stare at anything that throws light at us. And when we blink less, the meibomian glands, they are not squeezed as much. So every time we blink, close our eyes and open, the muscles squeeze the meibomian glands in the eyelids, and the oil comes out and that lubricates the surface. This doesn't happen. And therefore, the amount of oil on the surface is deficient. This leads to a quicker evaporation of the tear film from the surface, which is called evaporative dry eyes, which is related to screen time. So if you're talking about evaporative dry eyes, definitely excessive screen time is a risk factor.
Right.
But it has nothing to do with aqueous tear deficiency, which is mostly because of autoimmune diseases or immune-related conditions.
Okay. So so therefore you're saying that the two causes and risk factors are either, as you said, screen time, which affects the evaporative dry eyes, or it is autoimmune conditions which affect aqueous dry eyes. Okay. Are there other risk factors that may be there, like aging or genetics or any of those other risk factors?
So for evaporative dry eye disease, there are definitely, because the glands, the meibomian glands are essentially derived from they're modified sebaceous glands, which are present in our skin. So surface of the eye is, it evolves from modification of the surface of the skin. So the sebaceous glands that are there in our skin are basically modified as meibomian glands in the eyelids. So conditions that affect the sebaceous glands, like for example, very commonly acne, also causes meibomian gland dysfunction. So those people who have a lot of acne tend to also have meibomitis. And therefore the conditions, the risk factors that are likely to cause acne, for example, hormonal influence. So you would see it more often in young adults. It is also associated with other hormonal conditions like PCOD, etc. And its treatment can cause meibomian gland dysfunction and evaporative dry eye, other than screen exposure. So those people who have these two factors coexisting, they're more vulnerable to develop dry eyes or have more severe form of evaporative dry eye. For aqueous tear deficiency, since autoimmune disorders are risk factors, there are certain autoimmune disorders definitely which have a genetic basis, and therefore that can be. And then there are conditions where certain procedures like if somebody's had a bone marrow transplant for leukemias, they can develop something called a graft versus host disease, which can also cause immunological damage to the lacrimal gland and cause dry eye. So then that becomes a risk factor because somebody's had bone marrow transplantation.
Sleep deprivation. I guess it's evaporative, right? But I will let you answer.
Yeah, so it mostly will be evaporative. Aqueous tear deficiency, like I said, it can be caused by a very specific number of disorders which are all immune mediated. So I'll just list them out in case you've heard of them. Sjogren's syndrome, which can be primary or secondary. Secondary Sjogren's syndrome can be because of rheumatoid arthritis, can be because of lupus, or they can be because of very rare diseases which are characterized as cicatrizing conjunctivitis. This includes Stevens-Johnson syndrome, pemphigoid, and another disease which happens, some patients develop this after bone marrow transplantation, called graft versus host disease. Graft versus host disease, GVHD. So
right.
this is, what causes aqueous tear deficiency. They're all immune mediated. So you can't develop an immune mediated disease just because you're sleeping less. Everything else is evaporated.
Right. Thank you. And the last question.